Since the first COVID-19 cases in Indonesia were announced in March 2020, the government has been implementing a moderate level of social restrictions that have been adjusted from time to time. Like other countries around the world coping with the unprecedented impact of the pandemic, Indonesia has had to balance public health considerations with the effect on the economy. With this challenge in mind, we teamed up with Jabar Digital Service of the West Java Provincial Government and the Ministry of National Development Planning, with support from UNICEF Indonesia, to develop a COVID-19 risk assessment map for West Java Province, which is home to roughly 50 million people, making up 18% of the country's population. By identifying hotspots with a higher risk for COVID-19 spread, policymakers can then use insights to formulate a more localized, targeted and dynamic approach towards imposing and lifting social restriction measures whenever the conditions merited it. Part of innovation is about finding alternative use of data in times of COVID-19, and the risk assessment map we developed combines traditional as well as non-traditional data sets to pinpoint areas at the district and city levels using the following data sets. Waze data, which provides insights on traffic congestion. Disease incidence data, mapping patterns in confirmed cases across the province, as well as state-put data from Facebook movement range maps that measure the fraction of the population that stays around their homes. Several factors, however, contribute to the spread of the virus, such as the movement of people, but mobility by itself, or even coupled with disease incidence data, is not enough, as two areas with similar mobility and similar disease incidence data might end up with varying outcomes based on other factors such as population density. Therefore, to have a better understanding of transmission potential of each area, there's a need for data that has information on transmission factors, preferably at the smallest granular level, to support localized interventions. After identifying districts and cities deemed as high risk, the second stage of the identification process integrates Facebook population density maps and the Village Potential Census, which is an administrative dataset, also known as PODES. This dataset was used to understand structural factors that could affect transmission of the disease. In particular, the dataset was helpful in deriving two relevant metrics. First, the Transmission Potential Index, and second, the transmission risk. The Transmission Potential Index is the baseline measure representing the possible capacity of coronavirus transmission within each village before reaching the first case. This factors in several variables including transportation, slum areas, meeting points, and sanitation. Transmission risk related to COVID-19 analysis is an ex post measure, whereby villages without cases are assigned a zero risk regardless of their baseline scores, while villages where cases are confirmed are assigned positive risk associated with the number of cases and the baseline prospect. Following successful prototyping and installation of the interactive map in the command center of Jabar Digital Service, further user testing was conducted to ensure effective adoption and sustainability of the tool. In particular, this was to better situate the interactive map, as well as the information and insights derived from it, within the decision-making processes related to COVID-19 response at Jabar Digital Service and across the West Java Provincial Government. The pandemic has brought data innovations to the fore, and much of the demand has been to leverage alternative data of high spatial and temporal resolution that cannot be met by infrequent official statistics. Further opportunities include building on this existing work to simulate the relative extent of COVID-19 cases over time, based on the places of transmission such as home, workplace, and school. Such work can help inform policymakers' decision-making on possible measures to slow the spread of the COVID-19 virus.